So many of us want to help people in our lives. Whether you want to be able to provide guidance or support for a child, a family member, or a friend, or if you're a therapist, wanting to provide that same kind of useful help to your clients. But often, we may find ourselves feeling frustrated that our efforts fall flat, that they don't seem to work, or perhaps we don't even know where to start. Does that feel familiar? Well, today we're going to take a deeper dive into looking at what starts this problem, what creates it, and what can we do with it. My name is Dr. Jeffrey Rutstein, and welcome to the Wired for Wellbeing podcast, where we take a look at how your nervous system can impact the way you live, love, and relate. And each week I'm joined by my good friend and producer, Steve Lessard. Steve, how are you?
Hey, Jeffrey. Hey, everybody. I'm doing great today. I'm excited for our topic. It's kind of some interesting territory as we talk more about therapists and clinicians in this one, and excited to dive in. How are you doing today?
I'm doing really well, and I'm excited to sort of explore this topic together.
Before we go into the question that I have lined up for us, I do just want to take a moment because it's actually at a really interesting time and a bit of a perfect time because we're just wrapping up enrollment for your professional training program. And if you're a clinician hearing this and this is interesting and you're thinking, yeah, I need more of that, then we're going to have some information at the end of this episode, as well as in the show notes, if you want to learn a little bit more about that offering. If you're not a professional, don't worry. This episode's also very much for you, but we're sort of the Venn diagram circles are kind of bumping here, so we wanted to make sure we highlight that. All right, Jeffrey, but I've got a question from Gabrielle today, so I'm going to read it, and then let's have a discussion about what's going on here.
Perfect.
Okay, Gabrielle writes, I'm working with a new client who is in remission from MS and has deep trauma from the last severe flare-up. She can't focus on the breath, and any attention to the body causes fear and anxiety. I was exploring with her how she could begin to regulate the autonomic nervous system, besides going into her rational mind, and we discovered prayer and putting things in God's hands is a good resource. And yet, she spends weeks in an anxiety attack. The one regulating thing we found was washing her face or rubbing her eyebrows outwards. Once she recognized that dysregulation. Gabriella continues, I would really love to hear your feedback on how to reduce such a deeply disembodied state. So, Jeffrey, what's the struggle here?
Well, I think there's several. First of all, just to make sure all of our audience is on the same page, MS in this case stands for multiple sclerosis, which is a neurological disorder. It's a deteriorative neuromuscular disorder. And so there can be a lot of body pains and a lot of issues with movement, coordination, balance, and so forth. So this person is, the client in this case, is suffering from a long-term chronic illness, which impacts her life and her well-being. And to start with, I also hear in this that the therapist is outlining that this particular client has undergone some really vicious flares. There are moments when MS can flare up, can become very intense, and the symptoms are more pronounced and can be much more disabling. And so her last flare was so severe that it was traumatizing for her. Because of the level of experience I've had, and I'm hearing how much this particular client has a difficulty beginning to do almost anything to enter the body, to bring her awareness into her body, it makes me strongly suspect that in addition to her trauma from the MS, she may also have significant trauma from childhood, which may have also made her feel unsafe regarding her body autonomy or integrity. And this, of course, could be the result of if someone had been physically abusive or sexually abusive to her when she was younger. I'm just going to park that here for the side and saying that that's the context that I believe this client is presenting in therapy with. And the other issue is this clinician, like so many of us, wants to do good and sees a problem that this person is staying anxious for long periods of time, is forgetting to maybe engage in some practices to help her come back to regulation, and that even some of those practices themselves can send her out of regulation worse than they can help her in. So our clinician is feeling a little frustrated that she's having a hard time helping this client learn a new way of being.
Now, before we go too far, I want to make sure we bring in all of our audience because, I'm not a clinician, but I have loved ones in my life who I want to help. So I wonder if you can just help bring that segment of our audience in, the caregivers, the people who have the loved ones they want to help, and what some of those examples might look like, just so everybody's on the same page as then we start to unpack.
Sure. So for general life examples, it would be seeing a child have undue anxiety with friends, or with going to a social event like a dance, or having to give a report, wanting to help calm the child, maybe help the child learn some relaxation or soothing practices so they could be a little less stressed when they do this. And then what happens, of course, is the parent or caregiver wants to help the child, but the child just wants the anxiety to go away. They don't want to have to learn a breathing practice or an awareness practice. They just feel overwhelmed, and they probably don't, especially if they're under 12 or 13, they don't have the capacity to actually sort of be that aware of what's going on, that self-aware of what's going on in the moment, to respond helpfully. But in either case, we have here the parents' loving desire to help their child, give them a skill, and protect them from pain, which all loving parents want to do. And this child may not be in a place where it's interested in learning that. It would rather get a slip from mom or dad saying, I don't have to do this report, than ideas about how to do it and be less anxious. And so here a parent's needs and a child's needs are sort of at loggerheads. But this can also be that we have a friend who's going through a painful breakup, and we've been through many painful breakups ourselves, and we kind of know how it has gone for us and how long we felt down about it, and then we eventually come out of it. We may want to share some of the experience with our friend to maybe help them feel a little better, to give them a sense of light at the end of the tunnel. But sometimes people are not ready to see the light. They need to be in the dark. They need to feel their grief over this loss. And they don't want to be told what to feel or that it'll get better or what to do to help. They're really just being in their feelings. And so I think so many of us as humans want to help anyone that we care about in whatever way we can. If they drop something, pick it up. If they're feeling a little low, trying to give them a little boost. Just the things that friends do in relationships that family members can do.
Okay, so how do we meaningfully help those individuals then?
Well, that gets to another question, right? Which is it my agenda or is it the other person's agenda, right? So something that we teach a lot of in the style of therapy that I do is about not having an agenda. And I advise people who aren't therapists to also begin practicing not having an agenda. Because if I have an agenda, Steve, you and I are talking and you're telling me that you've been feeling down. So I've decided that, you know what, whenever I feel down, I just go and run 5 miles, and that helps me feel better. So without you asking me, I just say, Steve, have you thought about running 5 miles? You should run 5 miles.
I hate running. It's not happening.
Oh, well, if you run though, you'll like it and you'll not even care about the other thing that's bothering you. But you're telling me that you don't want to run, but I think running is a good job. And so here we get into this, right? Well, my agenda is if I can get you running, you'll feel better. Your agenda is I hate running, and I'm not going to do something I hate to make me feel better about something I'm not happy with, right? So part of this is also deciding who needs what. Do you need me to help you get out of your mood? Or do I need me to help you get out of your mood? Right? Am I picking up your desire, and am I picking up my desire? Oh, to be a good friend, I got to pick him up by the bootstraps and help set him on his way. Well, that's my agenda. That's not your agenda, right? You might just need someone to be in the mud with you for 3 minutes, or just to hear you without giving you a solution. Matter of fact, most of the time, the people around us just want to be received and heard, not fixed.
Yeah, I love that distinction of like not coming in with an agenda. Because when you shared it, you're like, well, I'm a planner. I kind of want to come into this with a plan. And maybe that's different than an agenda or could be. But what I heard that I really loved is like what's needed here. And oftentimes when I'm in some of these situations that I have the presence of mind to ask, I'll ask the other person, do you need me to listen? Do you want my feedback? Do you want to discuss something? And that was a real moment, not trying to jump in to have to fix the thing to make me feel better.
Yes, yes, yes. I think that there is something about clarity that's relieving. And I also do the opposite of that, because I know that sometimes when I'm bothered by something, I need to be heard, not fixed. So I will tell my well-meaning and often too verbal friends to be quiet. I want to tell them about something, and I actually just want them to listen. I don't need them to fix this. I'll get there. I just need a human to kind of bat this around with a little bit and to receive what I'm saying, right? And so it can help when we are clear, whether we're the receiver. And like you were suggesting, if I'm going to offer something, I'd like to offer something that will match what you need. So it makes perfect sense to say, so like, what would you like from me? Silence, to listen, to offer ideas. What's going to help you the most right here? And then that involves the other person. Instead of us just coming up with a plan and imposing it, we're now in relationship with the other person. And we're now, as we're seeking out this information, well, what would matter for you? I'm connecting more deeply with you. I'm asking you what you really need. And that's the first question. It's not what do you need from me? It's what do you need? And how may I serve that? How may I support that in some way?
So let's start reconnecting to Gabriella's question here.
Okay.
Where Gabriella has tried, or Gabrielle, apologies, has tried some things that work in the moment, some things that don't, some things they found, but then the individual they're connecting with and working with then experiences moments of deep anxiety or dysregulation. And Gabriella in their question says, I would really love to hear your feedback on how to re-educate. That's an interesting word.
Yes, it is.
Such a deeply disembodied state.
So I totally understand what Gabrielle is saying. I really do, about the idea of re-educating it. But our semantics say a lot. And the re-educating it idea is also about something acting on something else. How do I and her re-educate this nervous system? As if this nervous system is a wayward child and we have to train it to walk or train it to stay in a line, train it to follow what we ask. And that's a little bit off the mark. From a nervous system perspective, if Gabrielle is afraid of coming in their body, it's not about re-educating the nervous system. It's about helping the nervous system find that there can be safety in the body. Instead of right now, maintaining safety is maintained by staying out of the body for her. And so the question is not how to re-educate her, but it's what can be done to support her in feeling more safe. And that's why at the beginning of this, I mentioned that I think that there's a longer tail of trauma than just from her recent flare and all the disruption that caused. And I'm sure that was traumatic. But when we have a traumatic thing that's in our relatively current life, and it resonates with, it vibrates with an earlier trauma we had, then what happens is both of them rise up and their power reinforces each other. So I'm not just dysregulated because of my trauma from my last flare 5 months ago. It's that on top of reminding me how incredibly powerless and helpless I was in certain situations as a child, and how I couldn't do anything about my pain, or how people didn't believe that my pain was as severe as it was, or that I felt it was unfair and unpredictable. But my sense is there's a bigger cauldron of trauma in her past, and that's lending itself to be much more phobic about moving towards her body. Because if we connect with the body, we may connect with feelings. And a lot of people from traumatic backgrounds have learned that they can stay safe by staying distant from their own feelings. And one of the ways to do that is not to be in our body. So the work here is not just in re-educating her, but actually in helping her nervous system feel supported and safe in the moment, so that it can begin to explore little excursions, little shifts, 3 seconds of feeling your body, and then pull back out.
So I want to go a little bit more into that. I want to get a little bit clear idea of what that looks like for our individuals who maybe their nephew is going through something difficult that they want to help, or their loved ones going through something challenging, or in the case of professionals, they're working with somebody. What do you do in those moments?
So the first thing that I advocate is that our usefulness as a therapist, as a friend, or as a parent will be most effective and most enhanced when we are at least somewhat regulated. I can't teach you anything, guide you anything if I'm massively dysregulated. I just can't. I'll either be saying something out of anger or fear, so it'll have sharpness to it. That'll be extra. Or I'm going to be crushed and closed down, and I'm not going to have any energy and not really be reaching you with my words. And it's going to feel like it doesn't really impact you in any way. The way that I can connect with you is when I'm in a bit more regulated. I have the capacity. My nervous system and my brain have the bandwidth to actually be able to be connected with my experience and to also simultaneously connect with your experience. If I'm more in fight or flight, for example, I'm going to be coming much more from my agenda and what I feel desperate to do, and much less attuned to, well, what do you actually need right now? And I won't get to the curiosity about what you need unless and until I get a little bit more regulated first. I slow down my flight-filled or fight-filled mind, and I slow it down a little bit by coming into regulation. And then I have some bandwidth to feel, well, okay, this is my agenda, but what do you need right now? And I can begin to tune to that by, if my nervous system calms a little bit, I can actually begin to directly feel your nervous system and actually get more of a direct hit about what it might be searching for in that moment. And it may not be searching for something to do. It may instead be searching for signs of safety, which is going to be provided much more by the therapist or the parent or the friend finding first their way back into a little bit of regulation for them. Because that's part of the healing balm that we offer to the other person. But if we are regulated, we are inviting them to come a little bit more into regulation too. And then that can allow them some space to see the issue or the problem differently. And that's all that it takes. It doesn't take something huge. So going back to Gabriella's client, the focus would be on helping her get curious about what feels unsafe about being in the body, beginning to resolve some of that, and beginning to experiment in the moment, little tastes at a time of landing in the body and seeing how that can change things. And also ways of working with stuff if some anxiety does arise in the body, because it can, how to work with that in a way that you can become regulated again instead of just hijacked and overwhelmed.
I noticed a set of, and I'm going to need help with the words here, but like external regulating anchors and cues, as well as physical cues, right? Like, so you talk about, in this case, using prayer and putting things in God's hands. And then further on, they talk about, connecting with washing their face or rubbing their eyebrows. Like, is there a time, like those feel like different ways into
Yes.
our regulation? Help me out here, Jeffrey. Where am I? I'm hearing a difference here and I can't articulate it.
Okay. So when I think about God, or I think about putting my worries in God's hands, I have to have a little bit of regulation in me. right? I have to have enough space that I could actually feel like I could let it go. Because most of the time when we're worried, we're grasping onto that worry or that anger or that pain. This is a state of kind of saying, I'm going to let go and let God. I'm going to not have to feel like I have to micromanage this. And I'm just going to go with what God or the universe or life just has flow, has occur. So there's something about that. But Gabrielle also mentioned that even though this client had mentioned that she uses God and putting things in God's hands as a resource, Gabrielle also mentioned that our client can spend weeks dysregulated, which means that she forgets, as many of us do, to come back to resources when we're dysregulated well, because that's what happens. When we get dysregulated, we hyper focus on a problem. We never focus on the solution. When we're dysregulated, we only focus on the problem and how to kill it, run away from it, or disappear from it. But in no way do we even think about how to make it a non-problem. And that happens if I move towards regulation. I actually have more wiggle room to be in relationship with this issue and see ways around it or through it that I might not have seen before if I was locked into a defensive state. Because not only am I reduced in capacity then, but specifically, I'm reduced in any creative way of dealing with a conflict. The more activated I am, the more rigid I become. And if I'm a little bit more regulated, I can introduce a sense of flexibility. I can become open to ideas that I might not have even considered a few moments before. So, in her work, Gabrielle also helped her client then uh, find two physical activities that bring her soothing: the washing of the face and the stroking of the eyebrows outward. Now, these are two very direct physical practices that bring her awareness into the moment and into the physical reality of what's occurring, washing and stroking, instead of the thought loops of worry and overwhelm and despair that can go on instead. So often, for someone who's more highly anxious, doing something concrete, easy, and physical, like safe touch, is easier to help them relocate regulation than handing things over to God. Not that that's wrong, but sometimes we're just too dysregulated to do that. But we may not be too dysregulated to wash our face or to mm, rub our eyebrows, because those don't require a different mindset. They're just inviting a little bit of engagement and behavior. And so these are two ways that, even though Gabrielle said at the beginning that her clients terrified of going into the body at all, breath or any body practices can send her out. Okay, I hear that is true. But in the course of her work, she's also been able to help her find two ways, the eyebrows and the washing of the face, to interrelationship with the body without getting triggered. So to me, that's already a success for our therapist. She's already begun to find some simple ways to help this client begin to find a way of relating to her body that feels safe and comforting. And that's a first for her. And again, what's important is not whether progress is moving at our rate, whether I'm the therapist or the parent or a friend. I'm not the one to decide on the other person's rate of change. That's the other person. They are the one who is in charge of how much they feel like changing, how fast they feel like changing or are capable of changing. It's not something we decide. And that's where often we can get caught up. Well, I already told you the right thing. Why aren't you doing it? Well, we've worked on this 2 weeks. Why aren't you better? Well, we've talked about this and you read a book on it. Come on, it shouldn't take you this long. And again, that's all coming from this idea, an idea, mind you, of what healing should look like instead of the reality of what healing and growth actually are. They're gradual processes. They happen over time. They're cumulative. And we don't change 180 degrees in a lasting way overnight. That small change over time is what produces big transformation.
What I'm intuiting out of this as the layperson on the Zoom call here is there's a degree of not doing when we're
Yes.
working with others. Yeah. Okay. You seem to agree with that. Tell me your stance on that.
I think that we get screwed up by doing. And don't get me wrong, therapy is doing. As parents, there is doing, right? But we have an idea that the doing is to be done unto someone else. And that's not how nervous systems work. That's not how relationships work, right? And that a lot of times we want to do, and if you notice this, if you get curious about it, we want to do so we feel better. So, like, if I have a friend that's really distressed, maybe it pains me to see them so distressed. So, I need to do something to help them move out of distress so I'll feel better because I want them to feel better because I know they'll feel better if they're not in distress and then I'll feel better. But then again, I'm in that moment, I'm adding my expectations and my agenda on top of them. And that's not really a way of helping someone, right? The real way of helping someone is actually saying, what's needed in this moment? And what are they capable of receiving in this moment? Because you may be able to give them a wonderful dissertation on why eating this way or breathing this way is perfect for their health and their happiness, but that may be nothing about what they need. They may need you just to put your hand on their back. They may need you to just give them a hug or to just tell them, I know this is so hard. That there's actually something in the way that we are, our being, that is as powerful as what we say. And that when our being is more aligned, there's a way that we speak heart to heart. We speak from our heart, and it's received by the heart of the other. And when I do this either in therapy or I do this with friends, when I'm really speaking from the depth of me, there is a way that that gets transmitted in a felt sense of safe connection, safely being seen, understood, and received. And for many folks, especially folks with trauma in their background, that's not part of their experience. So again, going back to Gabrielle, the idea is to maybe do a little less and be a little bit more anchored in your own capacity for regulation, because she's going to borrow that as you help her build her own.
I found it interesting that the idea of the agenda came back and us entering these types of dynamics with our own agenda. And then I loved hearing you describe the felt sense that you feel when you know you're potentially operating outside of an agenda and connecting with the other person. I'd love you to help, our non-professional audience, our professional audience. What are some of the things that you've found in your body or the interaction with you and your clients or you and your loved ones or the things you offer professionals who are doing this work? How do they start to clue into, like, this might be the agenda at play or this might be my part at play?
So there's a couple of things. I do look at a lot of things through a nervous system perspective. So one of the things to tell if it's coming through an agenda is that there will be a quality of feeling a little contracted, a little pushed, a little desperate, or needing to get this done. There'll be a little bit of sympathetic fight or flight energy in our system. Need to fix this, need to say this, need to help them realize that hurting themselves is not the answer, or that doing this is the answer, or that refraining from that is the best thing for them. I have to do this, get them to see this, get them to realize this. That's a lot of activity, right? And it's coming from my nervous system. Now, traditionally, therapists were taught to look at their countertransference, how working with a client would bring up certain feelings in me that were from my own past, not necessarily from the client in this moment. And so from that model, therapists are supposed to be aware and tracking of how their reactions, nervous system or emotional or associative, are being triggered by what's going on with this person. So it's information about them, and or it's being triggered by our own issues from our past. Now, sometimes that can also be a message about our patients, but that's often a larger message about us. They're both important, right? But it's learning to see that when I'm with someone, when I'm landed, when I'm in connection, wanting to offer support and love, but not desperate to do it, there's not an inner push. I don't feel like I have to rush somewhere. I don't feel like I have to get us someplace. Again, in a therapy session or with a friend, that I believe that one of the things that's most valuable for us to offer to other people is our steady presence, is our ability to be in the moment with them without getting hijacked or without needing to shut them down. Oh, because that's too strong a feeling for me. So could you please not be so angry or so sad or so ashamed? A lot of times we quiet other people down because of what it brings up in us. And that's different than helping someone for their sake. If we're doing it because of what's gotten raised in us, there's a large investment in our own comfort, wanting to be maintained by getting someone else to behave differently. And that's a very much of an agenda. And someone else's nervous system is going to pick that up, that you're not really trying to help them for their sake. You're trying to impose something on them for your sake.
What threads do you want to return to before we leave this question for the day?
So I think all of our desires to help other people are lovely, right? And almost all of them come from some level of altruism, open-hearted care for other people. And it can also have strength be provided by our own unresolved issue, our own unmet pain, our own issues about shame or loneliness that we begin to over identify with in the client or in our friend, and then need to fix it in them so we can feel better. So that's the thing I'd invite people to get more curious about. When you desire to help someone, first check in, see if there's a desperate need from you, and then get curious about what's that desperation about. Because if there's desperation in it, it's actually going to push the person away. If you want to help someone, don't dive bomb them, right? You need to find a way to meet them and see if they're open to help and what kind of help they'd be open to before you make plans about how you're going to help them. In the case of a client, we have some ideas about what to help them, but where it really meets the road in both of these is when I'm in my body and I can be in relationship to your nervous system, to your body while we're talking. I get a whole bunch of other data that lets me know where you are and what you're needing. And so I'm no longer deciding this because of theory or just my experience. I'm also basing what I'm doing on a moment by moment exchange of what's occurring here between us, right? And again, that's what we can do is we can stay in touch during our conversation with if that kind of desperation or need to be right or prove ourselves or get the other person to agree with this, if that starts emerging, something else is driving this than just the desire to be of help. And again, our true desire is good. I wouldn't invalidate that, but sometimes we can accidentally get in our own way. Or in this case with Gabrielle, her desire to help her client is making her feel she's got to do something instead of, I think her client right now could also use a softening of Gabrielle to sort of be in that unsafe space with her and help her feel and empathize with how difficult it is, how scary it is. And of course, it feels this way. And let's just do a little toe drop. Let's just do a teeny little pinky in this and see what it's like. Gradual and slow is much better for most nervous systems than fast.
I appreciate you letting me, as we talk about fast, crowbar this episode in out of order, because when the question came in, it felt really timely because um, we're about to close an enrollment window for a really unique opportunity where I think this is a degree of what we're going to be doing with a small group of individuals. So I'd love for you to just let us know a little bit about what that experience is and where people can go get more information.
Yeah. So I've been thinking about this for many, many months, so at least a year actually. And I've been asked to do a training for therapists on this for several years, and I just didn't feel the time was quite right. I wanted to do it from a sense of inner ripeness, not from ambition. And the focus of this training, it's an intensive training for just 20 therapists. It's a master class. It's about how to really embody this way of being with other people where you work less hard, where you're more informed by what you're perceiving and receiving in the moment, and where connection and an inner understanding of your client become primary. Because the more that that's primary and the more that connection, safe connection is primary, the more potential there is in therapy for lots of transformation to occur. It's kind of learning how to get out of our own way even more and allow the wisdom that's already in us, the wisdom that we've accumulated from years of training and therapy, to find its fruition, not by being forced, but by allowing us to be whole as a therapist and as a human. So if this is something that really appeals to you, I would love to have you join. It's by application only because it's only 20 people, and I want to make sure it's a good fit between experience, orientation, and the capacity to meld together as a group.
Thanks, Jeffrey. I appreciate you painting that picture and offering this to individuals and friends. If you're interested, you can go to drjeffreyrutstein.com/links, and then there'll be a link on that page to take you to a spot to learn more about that. Jeffrey, back to maybe more podcast related tasks here. How do people get in touch with you if they have a question that they want to ask you?
So if you'd like to send a question, and we'd love to hear them, call 866-357-5156. Or if for some reason you can't reach that number, feel free to send an audio recording. And if you can't attach an audio recording, just a plain typed out email to hello@drjeffreyrutstein.com. And if you're interested in a free video that gives you some more information about what we do here on the program, you can also go to drjeffreyrutstein.com/links, and you can look up free gift. So the professional presence masterclass and the free gift will both be on that links page for you. Steve, as always, thank you so much for being my buddy in these conversations and explorations. I really appreciate it.
Yeah, thanks, Jeffrey. This was fun to kind of look at it from the clinician side. I feel like I stretched my knowledge base a little bit, but I was able to keep up and stick with you. And also just got a lot of useful things that I can use with my loved ones and my friends and my family of getting my agenda out of it and really being someone who can serve and who can help. Jeffrey, thanks. And I'll catch you next week. Thanks for being here with us.
Thank you. And remember, friends, this podcast is for informational purposes only and is not intended as a substitute for qualified healthcare. If you are struggling, emotionally or physically, please seek out a qualified healthcare professional. Friends, thank you so much for joining us today. Until next time, bye for now.